So today I thought it would be hopefully helpful if I talked a little bit about some symptoms that people get in the perimenopause and menopause. And it covers quite a wide range of symptoms, but the whole symptom complex is called genitourinary syndrome of menopause. And we can break those down into genital symptoms, sexual symptoms, and urinary symptoms. And what we know about this set of symptoms is they're really impactful in a very negative way on people's quality of life. So whenever people think about menopause and perimenopause, everyone seems to always jump to hot flushes or hot flashes, depending on which country you live in. But the reality is that those symptoms are called vasomotor symptoms. And with time, even if you don't do anything, the vast majority of women will actually completely grow out of those symptoms and they will fade with time. Now, I know there'll probably be some people listening who will be saying, oh no, I'm in my 70s and I've still got hot flashes, but definitely there are fewer people who continue with those symptoms. But the really unfortunate thing about genitourinary symptoms of menopause is, unfortunately for the vast majority of people, they actually don't get better. If anything, they get worse with time and they can be really, really debilitating. So if we first think about the genital symptoms, what people will be complaining of is dryness, burning, irritation. They'll will often describe that their clothes feel uncomfortable. They often don't want to wear jeans, or even sometimes things like a swimsuit feels very uncomfortable touching their skin. And they just feel like they feel very, very uncomfortable, and there's nothing that they can do to take that discomfort away. And then the other set of symptoms that people will complain of is urinary symptoms. And this can cause lots and lots of embarrassment. People feel that they constantly need to go to the toilet. So perhaps in the workspace, they're always feeling quite embarrassed that they have to keep excusing themselves to go to a bathroom, or they're not having the ability to work their way through a whole meeting without having to excuse themselves. And they also find that socially, it's very embarrassing. If they're out for dinner with friends, they're always having to nip off and go to the bathroom. And if they're going on a car journey, they just know that they kind of need to plan their car journey with lots of pit stops along the way, because they have this terrible urgency. And it's not a case of, oh, well, you'll just have to wait. There's not a bathroom. They know that if they can't get to the bathroom, then it is going to end in disaster. And those urinary symptoms are not only that urgency, but also having a wee just becomes really uncomfortable. It can be quite stingy and burny. And also this unfortunate propensity to getting constant urinary tract infections. So just always feeling that they're needing to run to the doctor, or they're always taking those little sachets that you buy at the chemist to try and prevent those symptoms of burning and pain every time they need to have a wee, and also having their night sleep constantly broken by having to get up so many times during the night. And then the third set of symptoms, as I said, are the sexual symptoms. And that can be that sex can actually just be downright painful. Some people will describe it that it feels like burning, or it feels like sandpaper. It just feels really, really uncomfortable. There's this horrible friction feeling, and it just is such a turn off that actually they absolutely dread having sex. And then the other symptoms that they will complain of is that not only do they feel very, very dry, but actually their sex drive has completely gone as well. So they're just no longer interested. They kind of rather read a good book or watch TV. It's just probably a combination of psychological, you're not really feeling that they've got the desire, but also couple that with it being really uncomfortable, and it's a recipe for disaster. So what's the reason for all of these symptoms? Well, again, unfortunately, it is that rapidly plummeting estrogen level. So we know that estrogen has receptors in all of those pelvic organs. So there's estrogen receptors in your bladder, in your urethra, which is the tube that takes urine from your bladder to the outside. We know that there's estrogen receptors in the muscle of your pelvis and your pelvic floor. There's estrogen receptors in your vagina and your vulva. And basically, in simple terms, the lack of estrogen means that there's not as much collagen, hyaluronic acid, elastin, and the tissues have become really, really thinned. So if you've got thin tissue, it has that real vulnerability to being irritated physically. And that irritation could be by clothing, obviously it could be by sexual contact, or any kind of trauma is just making it extremely uncomfortable. We know that, and I see every day in my practice, that as women get older, they're just more and more prone to urinary tract infections. And in fact, sadly, a lot of women will ultimately succumb. One of the causes of death is often complications of urinary tract infection. We see lots of women in nursing homes who get just UTI after UTI after UTI, and it just seems just to be this endless cycle. So these are the symptoms that are probably not quite as talked about. People have a bit of a laugh about their hot flushes, and that seems like something that you can share with people and have a bit of a giggle with your family. But these symptoms people find really embarrassing and quite humiliating. They feel that perhaps they're the only person who has it, or they're the only person who has it to this extent. And, it can have a real impact on people's intimate relationships, friendships, ability to socialize, and in fact, even ability to work, because they're basically feeling so uncomfortable all of the time. And I do think it's a great tragedy that, there's so many women out there who are struggling along with this and feeling really horrible inside, that there's something wrong with them, or, maybe they're just a bit of a, hypochondriac, and why don't they just get on with it? And the reality is that these symptoms are really real. And so, for example, as a doctor, if I were to examine women, there are visible changes that I can see. The tissue looks pale, or in the vagina, there's like little contact bleeding or little tiny bruised areas. You can just see that it looks really traumatized. And you can even see sometimes changes in what the urethra looks like on the outside. So we're definitely seeing physical changes. These are not changes that are all in people's minds, and they're just imagining it. They're really having all of these symptoms. So what can you do about it? Well, there are lots of things, but first and foremost, really, we do need to think about how can we replace that estrogen, hormone replacement therapy, and that can be in the form of a patch or a gel or a tablet. But also we can use vaginal estrogen. Depending on the country that you live in, there's lots of different options. In Australia, it's mostly little pessaries, which are like tiny little tablets about the size of a Tic Tac that you pop into the vagina, or there's some creams, which are great, but can be a little messier. But in other countries, they do have various little rings that you can pop into the vagina and slowly release estrogen. The other thing is to get a good vaginal moisturizer. That's a little bit different than just a lubricant. So probably most people have heard of KY jelly and various lubricants, but they are kind of, one and done. You use it and then, a few hours later you would need more, and they're really helpful. But if you use something that's a vaginal moisturizer, and we'll put some notes below, just giving you a few examples, then that is something that stays in the vagina probably for about 3 to 4 days. So you get that kind of long-lasting moisture. And one of the main issues is that as you go through the menopause, you lose the ability to make a lot of that kind of mucus and natural lubrication, and by replacing that, you're going to feel a lot more comfortable. So I hope that helps some people understand that they're not alone. We know that about 20% of women after the menopause have severe urgency. About 20% of women have stress incontinence, and about 48 to 49% of women say that they have had a real change in their intimate relationship because of these genitourinary symptoms. So you're definitely in a quiet, silent majority of people who are struggling. So do go and see your doctor, or if you don't get any satisfaction there, ask your doctor to refer you to see a gynecologist. But there is definitely lots of help out there, and no one needs to put up with these symptoms. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.